Right now, your body could be screaming a warning that you're just not hearing. It's not a loud alarm, but a whisper. That little cough you can't shake, it's the number one sign most people ignore. Understanding what it means could save your life, but it's the way this cough behaves that tells the real story. Let's explore that together. Lingering cough. Let's start with that cough because it's the most dangerous and, tragically, the most ignored sign of all. Up to three-quarters of people diagnosed with lung cancer had a persistent cough, yet most brushed it aside for months, even years. This isn't the kind of cough you get with a cold. It often starts dry and hacking, and it just stays. No matter how many cough drops you take or how much tea you drink, it doesn't leave. What makes it so deceitful is that it feels just like allergies or a simple cold at first. It might even seem to get better for a little while, giving you a false sense of hope before it comes back with more intensity. You might notice it gets worse at night, disrupting your sleep and just slowly wearing you down. While a normal cough from a virus clears up in a couple of weeks, a lung cancer cough lingers for months. This stubborn, on again, off again pattern is a critical red flag that needs your attention. Breathless feeling. Do you find yourself getting winded doing things that used to be easy? Maybe it's climbing a flight of stairs or carrying in the groceries. This is one of the most misunderstood symptoms because it creeps up on you so slowly. You don't just wake up one day unable to breathe, it's a gradual decline. So gradual, in fact, that most of us just adapt to it without a second thought. We start taking the elevator instead of the stairs, or we sit down more often, blaming it on getting older or being a bit out of shape. Here's what's really going on inside. A tumor could be blocking an airway, or fluid might be building up around your lungs, making it harder for them to expand fully. It can feel like you're trying to breathe through a straw or like there's a heavy weight on your chest. The real tragedy here is not just the breathlessness itself, but how easily we normalize it. We accommodate it, making our world a little smaller each day, never realizing our body is trying to signal a much deeper problem. Aching chest. When we think of chest pain, we often imagine something dramatic and sudden, like a heart attack, but lung cancer pain is usually much quieter. It's often a dull, persistent ache on one side of your chest that's easy to mistake for a pulled muscle or even heartburn. Because it's not dramatic, it's dangerously easy to ignore. This type of pain has a few telltale characteristics, though. It often feels worse when you take a deep breath, cough, or even laugh. It might start as a small, occasional twinge, but over time it can become a constant nagging ache that never fully goes away. Some people feel it radiate into their shoulder or back, which again can feel like arthritis or a simple muscle strain. This pain happens when a tumor grows large enough to press against nerves or the ribs inside your chest cavity. When chest pain sticks around and seems to worsen with breathing, it's not something to just endure. It's a clear signal to get checked out. Voice changes. Have you noticed your voice sounds a bit different lately? Maybe it's hoarse, raspy, or just weaker than usual. It might seem like a strange symptom to connect with your lungs, but it's a fascinating and serious warning sign. In your chest, there's a long nerve called the recurrent laryngeal nerve, which controls the muscles of your vocal cords. A lung tumor can grow large enough to press on this nerve, paralyzing one of your vocal cords and changing the sound of your voice. What makes this symptom so sneaky is that we often blame hoarseness on allergies, a cold, or just talking too much. But if your voice has changed and it doesn't get better after a couple of weeks, it's something to take seriously. It can show up months before any other symptoms appear. You might be the only one who notices it at first, just a feeling that your voice isn't quite right. This subtle change is a direct message from deep inside your chest. Dropping weight. Have you been losing weight without even trying? While that might sound nice at first, it can be a serious warning sign. If you've lost a noticeable amount of weight, say more than 10 pounds in 6 months, without changing your diet or exercise habits, your body is telling you something. Cancer cells are incredibly greedy. They consume enormous amounts of energy and steal nutrients from your healthy tissues to fuel their growth. This isn't like regular weight loss. It's often accompanied by a loss of appetite or finding that food just doesn't taste the same anymore. Your body's metabolism can go into overdrive, burning calories much faster than usual, even when you're resting. You might notice your clothes getting looser or see a change in your face when you look in the mirror. It's a quiet but dramatic signal that your body's resources are being hijacked for a dangerous purpose. Deep fatigue. We all get tired, but cancer related fatigue is a whole different experience. It's an overwhelming bone deep exhaustion that sleep and rest don't fix. Up to 95% of people with lung cancer experience this, and yet it's often the last thing we'd associate with something so serious. We blame it on our busy schedules, stress, or just getting older. It can feel like you're trying to move through molasses, where even the simplest tasks feel like a monumental effort. This isn't just physical, it's mental too. You might experience what's often called brain fog, difficulty concentrating, feeling forgetful, or struggling to follow a conversation. This happens because the cancer is siphoning off your body's energy and can even lead to anemia, which means your body isn't getting enough oxygen. This profound sense of being drained, especially when it comes in unpredictable waves, isn't normal tiredness. It's a sign your body is fighting a serious internal battle. Bloody cough. Coughing up even a tiny amount of blood is alarming, and it should be. It's a symptom that should never, ever be dismissed. For about a quarter of people with lung cancer, this is one of the signs they experience. The blood might appear as small, bright red streaks in your mucus, or it could give your sputum a pinkish or rust colored tinge. Sometimes it's the first thing you notice when you wake up in the morning. This happens because a tumor growing in the lungs can damage the delicate blood vessels in your airways, causing them to bleed. The irritation and inflammation around the tumor also make these vessels more fragile. What's important to know is that the amount of blood doesn't necessarily relate to how serious the cancer is. Even the smallest speck is a sign that something is wrong internally and is your body's clearest cry for immediate medical attention. Frequent infections. Do you feel like you're constantly fighting off bronchitis or pneumonia? Does it seem like just when you get over one infection, another one begins? When these infections keep happening, especially in the same part of your lung over and over again, it can be an early sign of lung cancer. A tumor can act like a roadblock in your airway, trapping bacteria and preventing that area of your lung from draining properly. This creates the perfect breeding ground for an infection to take hold. The problem is, you and your doctor might be so focused on treating the infection with antibiotics that the root cause gets overlooked. The antibiotics work for a little while, but because the blockage is still there, the infection almost always comes back. This cycle of getting sick, feeling better, and then getting sick again can go on for months or even years. If you're caught in this pattern, it's worth asking if there could be something more going on. New wheezing. Wheezing is that high pitched whistling sound you make when you breathe. And while we often associate it with asthma or allergies, new onset wheezing in an adult can be a quiet warning sign of lung cancer. This sound is created when your airways become narrowed or blocked and air has to force its way through. A tumor growing inside your lung can cause this exact kind of obstruction. There are a few things that make cancer related wheezing different. Often you'll only hear it on one side of your chest, unlike asthma, which typically affects both lungs. It might also get worse when you're in certain positions, and it likely won't respond to typical asthma medications like an inhaler. Since respiratory issues can become more common as we age, it's easy to dismiss new wheezing as just a part of getting older. But when it's persistent and new to you, it's a sound worth listening to. Facial swelling. Have you noticed any puffiness in your face or neck when you look in the mirror, especially in the morning? This is a serious symptom known as superior vena cava syndrome. The superior vena cava is a large vein that carries blood from your head and arms back to your heart. A tumor in the chest can grow large enough to press on this vein, causing a traffic jam of blood that backs up into your upper body. This leads to visible swelling in your face, neck, and sometimes your arms. The puffiness is often most noticeable when you first wake up because lying flat all night makes the blockage worse. As the pressure builds, you might also have headaches, feel dizzy, or notice the veins in your neck and chest becoming more prominent. Your skin might even take on a reddish or purplish tint. This symptom is a sign that a tumor has grown quite large or is in a very specific, dangerous location near major blood vessels, and it requires immediate medical evaluation. Aching bones. A deep, nagging ache in your bones, like in your back, ribs, or hips, that just doesn't go away could be a sign that lung cancer has spread. This is different from the pain of arthritis, which usually feels worse with movement and better with rest. Cancer related bone pain is often described as a constant, deep ache that's there even when you're lying still. In fact, it can feel even worse at night when you're trying to sleep. When lung cancer metastasizes, it most commonly travels to the spine, ribs, and pelvis. Pain in your back might radiate down your legs, or pain in your ribs might get worse when you breathe deeply. If it's in your hip or leg bones, it could cause a limp or make it difficult to walk. This symptom means the disease is in an advanced stage, which is why catching the earlier, more subtle signs we've discussed is so profoundly important. Brain fog. Forgetting names, feeling confused, or having trouble with your balance might seem like they have nothing to do with your lungs, but they can be a sign that lung cancer has traveled to the brain. When this happens, it can cause a wide range of neurological symptoms. The first sign is often a new kind of headache, one that's typically worse in the morning, doesn't respond well to pain relievers, and may intensify when you cough or bend over. Other signs can be more subtle at first. You might have moments of confusion, struggle to find the right words, or feel unusually dizzy. Some people experience personality changes or have seizures. These symptoms often develop gradually, making them easy to dismiss or attribute to other things. It's a terrifying thought, but it underscores how far this disease can reach if it isn't caught early. Recognizing these changes as a possibility is a crucial piece of the puzzle. Your next step. These 12 signs are the whispers of lung cancer, a disease that masters disguise by hiding behind everyday complaints. Hearing about them isn't meant to scare you, it's meant to prepare you. Knowledge transforms fear into action. Having these symptoms doesn't automatically mean you have lung cancer, but their persistence, their pattern, and their presence together are a clear call to listen to your body. Trust your gut. No one knows your body better than you do. If something feels off, don't let fear or embarrassment stop you from asking for help. Your life is far too precious to gamble with. You now hold the knowledge that can save a life, maybe your own or maybe someone you love. Listen to the whispers before they become a scream. Share this with someone who needs to hear it. Taking care of each other is how we win.